HIV and AIDS scourge, making home-based care a preferred model. Kisumu County has trained and sensitized over 2,400 health workers and 2,900 community health workers on how to handle COVID-19 patients on home-based care. Kevin Ogutu with that story.
And 2002, over 2 million Kenyans became infected with the HIV virus. This came at a time treatment was way above the means of poor households, as the majority of those infected were young adults. The epidemic had a tremendous impact on multiple sectors of the country's society, particularly in Nyanza region. Here, with over 1 million AIDS orphans and a devastated economy, the government and other players had to engage at a time there was a lot of stigma associated with the disease.
And earlier, even when there was no medicine, because when I was diagnosed, I was buying medicine, yes? But before that, what people used to rely on was, because we could not afford medication and the rest and all those kind of things, it was just about good nutrition, and because poor people, particularly in the informal settlement, it was about good nutrition, ensuring that you are clean, your immunity is high, and also that caring, the social aspect of community members around you.
Eric Okioma has been living with the HIV virus for nearly 20 years. With the high burden on public hospitals occasioned by a spike in HIV infections, it was time for community-based care.
There were hospitals who were overburdened and all those kind of things. And so living in an hospital, at times, you could easily even get a disease which you did not take you there. And you see a person living with HIV is a person who was predisposed because of low immunity, could get sick. So the home-based care component came in.
On the 9th of August, Health Cabinet Secretary Mutahi Kagwe was a guest at the lakeside city of Kisumu, and from Jaramogi Oginga Odinga Teaching and Referral Hospital, he was to give the daily briefing on COVID-19 pandemic. Kisumu and the country as a whole continue to register a remarkable number of recoveries from COVID-19 patients on home-based care. On this day alone, 983 of the recoveries were recorded from home-based care.
This cannot happen without the 2,400 health workers who have been sensitized on COVID-19 disease, with a further 405 having been trained on case management. At village level, sir, we have over 2,900 community health workers sensitized on COVID-19 and further 48 trained on home-based isolation.
At Nyalenda Estate in Kisumu, KTN News caught up with Fred Misachi and Caroline Ondoro, who are both community health workers with over 10 years experience. Fred Misachi says with the availability of antiretroviral drugs, very few HIV/AIDS patients are placed under home-based care.
The approach is similar. It's only that with COVID-19, you keep a distance, but with HIV patient, you can go closer. The big difference is only that this is a new disease.
Caroline Ondoro takes us through the changing roles of community health workers and how the novel coronavirus has complicated their operations.
The client will be given a thermogun to take his temperature daily. And then there are signs. We'll tell the client that those guidelines we are given in a paper. You take the client through. If he or she sees any sign, it is upon the client to call you back and inform you about the signs. If it is manageable in the house, well and good. If the signs changes, it is upon now the community health volunteer to communicate back to the public surveillance team, now to take the client again.
Margaret Alwach has been a community health worker covering Manyata B area for well over 3 years, and she has had her job as a community health worker well cut out until COVID-19 set in.
Before COVID-19 started, it was our responsibility to visit households, do health education, sensitize them on the importance of visiting facilities in case of anything.
This meant door-to-door meetings without any restrictions on social distancing. It was a different time. At the Kisumu County Hospital, we meet Peter Ogwell, public health officer with many years' experience in the running of home-based care programs. He says the first thing to do is to ensure community involvement.
The community health workers are able to supervise the households where we have these people who are positive COVID-19. And that means that the key thing is infection prevention control.
The COVID-19 patient must first of all be asymptomatic. That means that inasmuch as he or she shall have tested positive for COVID-19, they should not exhibit any symptoms, and at the same time, they should not be suffering from any underlying medical condition such as diabetes, high blood pressure, or cancer. The public health officials have to visit the household where the COVID-19 positive patient will be put under home-based care, and there is a checklist to that effect.
This person is supposed to have his room, he has to have adequate supply of clean water, access to sanitation, good nutrition, and advice from the community health workers and health care professionals. Then this person will be placed on home-based care.
The government is banking on home-based care as the battle to curb spread of COVID-19 continues, given the high number of positive COVID-19 cases that are asymptomatic. With the proper management and a home-based care approach, this can help decongest the isolation centers and at the same time curb the spread of the virus. Kevin Ogutu, KTN News.